Everyone, today we'll be discussing about bacterial otitis externa. Okay, in bacterial otitis externa we have localized and the diffuse. In localized we have infections of the hair follicles. Okay, localized is defined as infections of hair follicle in the outer cartilaginous part of EAC, usually caused by Staphylococcus aureus. Okay, let's talk about here. This is auricles and this is EAC, and this EAC composed of cartilaginous part and the bony part. This cartilaginous part consists of ceruminous gland and pilosebaceous gland. Also there is presence of hair follicles. If the hair follicle get inflamed by the Staphylococcus aureus, what happens? It is called as localized bacterial otitis externa. So just define again what happens. Localized otitis externa is defined as infection of the hair follicles in the outer cartilaginous part of EAC, usually caused by Staphylococcus aureus. Okay, that is bacterial otitis externa. So what are the clinical features? The clinical features are earache, variable intensity, and can be severe. Okay, so what happens? Earache is variable intensity and then can be severe, but there is swelling, abscess. Okay, that is variable size, situated in and around the metal opening. Okay, that is situated in and around the metal opening, and there is discharge. Okay, and discharge is scanty if furuncle burst. Hearing loss, mild is present only if the furuncle occludes the EAC. Okay, there is earache, which can be variable intensity and can be severe. There is swelling, abscess, variable size, situated in and around the metal opening. There is discharge and there is hearing loss. Okay, mild and is present only if the furuncles occludes the EAC. Okay, so these are the clinical features. Okay, now you can see over here. So what is this? There is localized involvement. So this is localized bacterial otitis externa, but if the involvement of over here, there looks like diffuse. Okay, so this is diffuse otitis externa. Okay, and then we have signs. So we have tragal tenderness. Okay, inflamed skin and swelling, discharge is scanty. Okay, and there is granulations and there is hearing loss. Okay, so these are the feature of bacterial otitis externa, that is localized type. Okay, so there is earache, which is variable intensity and can be severe, swelling, abscess, variable size, situated in and around the metal opening. There is discharge, there is ear loss. Ear loss is only present, okay, if there is mild. Okay, it is present only if the furuncle occludes the EAC. Okay, hearing loss is only present if the furuncle occludes the EAC. Okay, and there is sign tragal tenderness, inflamed skin and swelling, diagnosis is scanty, granulation tissue, hearing loss. Sometimes there is palpable lymph nodes. Okay, this hygroscopic actions of glycerin reduces edema, while isthathol, what happens? It is isthathamol, what happens? This is what happens. This causes act as mildly antiseptic. Okay, so that is the things over here. Okay, so treatment: analgesic and local heat, antibiotic, antiperspirant isthatholol in glycerin airway, incision and drainage of abscess. Okay, in this way we completed bacterial localized otitis externa. Okay.